Now we'll move on to the next session. Everything is towards AI, and we have Dr. Avinash Supe, Director Clinical Governance and Head Hinduja Hospital Khar, and Emeritus Professor of GI Surgery and Medical Education.
Thing. Thank you. I think you can just, it's okay. Everybody knows me. Just can we go on to this presentation?
One sentence I want to say that I feel privileged to chair the session of such an eminent personality.
Sure. Thank you.
And plus, he is actually walking and talking with the education person.
Thank you. Thank you so much. Thank you so much. I think after wonderful talks by the first three speakers, and I think Tejinder's insight, Heturaman sir's authentic touch, and Dr. Farnaji's, I think I have to speak on what is something which is coming up in the future. And I think this was, thank you Mahalakshmi for making me speak on this topic, because I feel this is one I went into this much more deeper into this. Thank you for all the people from the AVMC. The saddest aspect of life right now is that the science gathers knowledge faster than the society gathers wisdom. I think this is something which all of us should understand. You know, we are growing too fast and we are not able to catch up. So assessments are essential. I think everybody talked about assessments. Yes, they are essential. Issues with the current assessment. Today, I think all of us, I would just summarize them into 5 issues. Assessments are onerous, difficult for educators to design and implement. I'm sure I was sitting with Jyoti, and after listening to all 3, she is now worried about her job as COE, how difficult it is. So carefully craft rubrics, questions, one part of educators' practice. Assessments may be discrete. Everybody talked about, we are talking about discrete assessment of people. We are not really doing whole assessments. We are taking them in shots. OSCE, one system, one thing like this. Tell us students do and do not know at a given time, but they may tell us nothing about learning. Uniform assessments. We want all assessments to be uniform, in spite of what are students' abilities, their backgrounds, knowledge, skills. Take same tasks, same items, and not calibrated to the student's current state. They are inauthentic. I think I don't have to say more. Everybody said today that our assessments are inauthentic. Assessments are often inauthentic. Many times students are asked to do tasks that are not in the real world. And antiquated. We still work with those old pathology specimens in pathology museum and ask them same questions which were asked 30 years ago. And I think, can we not use now images and 3D images? It's time to come when we should really change. So these are the 5 summarized issues with assessment. I'm sure there are many more, but I thought these were very important. Now, traditional assessments are tailored to the culture of institute rather than purpose of study. I think all of us think about it. We normally try to do culture of university, culture of institute, rather than what was the purpose of study, what we want him to be outside. Though we talk big about IMG, the assessments remain to the culture of study. So came assessment and AI, the new world of assessment and AI. And everybody started looking at, oh, AI has come, AI has come. What will AI do really? So let's go into a little deeper aspect of this. The first thing AI is likely to do is to make it onerous to feasible. That means, what will it do to fully or partially automate the parts of traditional assessment and generate assessment tasks and reduces the burden on humans? It's going to be relief to the teachers. I'm sure I'm going to talk like this. So automated assessment constructions. It will make all automated assessment constructions. Answer guided graph convoluted networks, key sentence tagging schemes, You know, in all these kind of a system pictures you see in today's papers on assessment, you will find blueprinting can now be AI based. And now everybody has started working on towards blueprinting, you know, developing a blueprint. In fact, if you see, automatic generation of question paper bank is now there already in India, and it can be refined by AI. So now things are becoming better for a teacher. Look at this Nature paper from 2022. The researchers using AI to analyze peer review. Large class size is challenging. Peer assessment with summary statistics, advanced consensus approach. All this is going to be now easy for us to do this. Writing analytics has come in a big way. You know, AI has two important aspects. One is writing analysis and MCQ. I mean, you'll find MI writing, you'll find essay analysis, development of ideas, organization, all that can be now analyzed. And look at these now kind of apps, programs which are coming, MI Write, which will help us to assess students much better, maybe subjective and objective together. Look at these writing softwares with AI. You know, AI-based software help teachers to facilitate their practices, assess and effectively influence students' writing motivation. In fact, ChatGPT and plagiarism, we are all worried about ChatGPT coming and it's going to change. ChatGPT is not actually copying or pasting chunks of text from its training. Instead, it is generating something entirely new each time to use it. It's like takes an inspiration from all that is it's read and then creates something uniquely of its own. It's not plagiarism, it's more like AI-based creativity. But you will find using ChatGPT to create some content and pass it off as your own work, this is a little tricky. Originality AI can spot if the text has been written by AI. Now today we have many softwares which will tell whether he has done by ChatGPT or AI, and we can really spot that. So there are a lot of AI techniques for this. One is scoring task, classification task, ranking task, provide feedback. Look at this tool, Khar Writer, combines NLP pattern matching to identify the presence and absence of certain rhetorical moves. Now, another research line closely related to automated essay scoring is plagiarism detection software. You know, you can really go into all this semantic text analysis. So now what is the final thing? We can make assessment from onerous to feasible, offload tasks from the humans to AI and help to make assessments practices more feasible to maintain. Whatever the issues which were there, we were talking about, I am not able to do it because we are reliability and all that, we will try to make it with AI. It removes bias in assessment. And all there are enough publications in ERIC now about this. Fair and consistent grading, evaluate responses without being influenced by factors like gender, race and background. The second important part AI will do is discrete to continuous. You know, we were talking about patchy kind of an assessment. AI will now do a continuous assessment. More continuous view of performance and thus insights into learning, which was not possible with the kind of assessments we are doing. You know, electronic assessment platforms have come. You know, today you'll find more and more electronic assessment platforms have come, online and offline. Ability to deliver questions, multimedia, you will find this. Why online assessments is a great e-learning tool, anywhere, anytime, quite quick marking and all this you will find. And you will find there's a concept called as a stealth assessment. You know, this was introduced sometime. While people play a game or do an activity or day-to-day activity, it will pick up and it will start assessing you at the same time and electronically, and it will give you a final thing. That means what? It's a continuous kind of assessment rather than a discrete assessment. In fact, using such models allows system to use a weighted aggregation and gives you more reliability. They collect data to go beyond whether students have simply answered question correctly. Look at this, even CARE now has come where I think today also I saw the whole mannequin systems is now doing where it's all done on mobile. You get analysis of your students, you get each student's analysis. So we are doing now towards the digitalization where we are collecting this data continuously and we are getting really. So it is reducing the burden, at the same time we are getting a continuous assessment over a period of time. Now this is evidence-based, formative assessment and support of pedagogy decision. Now the third thing is from uniform to adaptive kind of assessment. Now, as you say, we used to do all uniform assessment, but today we need to do an adaptive assessment. I mean, rather than giving the same assessment task to all students, AI has developed that adjust the task to students' abilities, giving them tailored assessment experience. And this is something which is very important. Adaptability in AI has come. Maybe it's very difficult for us to do it because we want him to be competent. But at the same time, we want him to be adaptable. Now, balancing this is going to be a little difficult. But as the science grows, we might be able to find some solutions on this. So, adaptive learning systems can adjust the pace and difficulty of lessons, tailor the difficulty of questions based on students' responses. To take adaptive testing operational, the size of item pool must be large enough so that selection of algorithms can administer suitable item. You know, we have to worry about somebody, mugging the checklist. But if he has 1,000 or 2,000 checklists, if he has mugged and he is to the context, we have achieved what we want to really achieve. The fourth was from inauthentic to authentic. Authentic assessments measure learning using tasks. So AI and simulations can be converted into authenticity, so make it more contextual. And lastly, from obsolete to updated assessments, AI helps you to base your assessments on updated techniques. So this is why whatever the limitations of assessments were there, AI has probably trying to change it. Let's take examples of how AI is going to change assessment into medical situations, because that's our question. Let's look at last 4 years publications on AI. You will find thousands and thousands of publications, but I'll try to quote few relevant publications for your understanding. So what has come into the literature is learning analytics and surgical competence. We are talking about competence, so let's talk about learning analytics. Now, how do we achieve competence? If somebody is achieving competence, I'm sure this is a classical Dreyfus model which we look from novice to expert. Now, what we used to do conventional skill, we used to observe, assist, perform under supervision, perform independently remote, and perform independently. And as a surgeon, as a teacher, I used to say, okay, you can now perform independently. You can perform with assistance. That was very classical way I used to teach my PGs. Then came Erickson's model of deliberate practice. So once he achieves that practice, he will achieve something. Then came effect of simulation-based training on surgical proficiency and patient's outcome. You know, these all papers, if you really see how it brought simulations. And improved performance with learning analytics. People started say, okay, I get learning analytics and I make a change, give a feedback, my students will learn better. Now, what I want you to do, I remember this in somewhere in laparoscopy came, we started doing something called as a video motion analysis. How much he's using his right hand, how much he's using left hand, and we used to draw a graph, his left hand versus right hand, and give him a feedback whether his left hand has achieved something and he has become competent. But now, AI has changed the whole thing. Adaptive learning has changed the whole thing. What it has done, artificial intelligence and learning analytics, personalized learning on based of analytics. And from artificial intelligence, we have gone to the deep learning. And if you really see, we have got augmented reality now. You know, we have got now models like this, where the girl can really find out where is ureter. She can do on augmented reality check. She can really say where is ureter, and you can get exact feedback how many times she really did it right or wrong. Look at laparoscopy. They collected large amount of visual data. And this was a wonderful paper from Surgical Endoscopy 2021, fairly recent paper. They put all data and divided the laparoscopic image analysis into classification, detection, and segmentation. Classification is the task of assigning whole images. Detection is allows the identification of the location of lesions. And segmentation is to exactly whether he is able to do this, what we called as an, gallbladder and safety technique. So this is one paper I want you to see, deep learning and convolutional neural networks. Now they have 5 components: anatomy detection, instrument detection, action recognition, phase detection, and surgery duration prediction. Out of which I'll show only one paper of instrument detection. Like how somebody as a student using his instruments. So it gives a complete kind of an AI gives me complete kind of a thing. It recognizes the presence of a tool in surgical field and detecting the location of the instrument, like how much he uses his instrument, how stable is his hand. Now these we were not able to do it before. Now they will analyze all his videos of last say 10 cholecystectomies, and they will give you analysis which hand he is using and which hand he is not using. And there is an imbalance between the training data set, like unbalanced and tool balance, depending upon whether he is an expert or is not expert. You will find a difference between how much is his grasper balance, bipolar, hook, scissors. So people are going now in details of this, and they are trying to find out whether my surgical competence, how I can refine it. And I can tell him, okay, you are using your grasper or cautery which is moving. I need to stabilize it. The range of movement has to be less so that injury you cause is likely to be less. Now, if I am able to give him that AI feedback, and I can see that he changes his AI-based kind of an assessment, I can improve him better, and I can assess him better, and I can then qualify him better. So these are all new coming up over a period of time. So I'm sure I can talk about this, but how reliable it is today, I think they're still working on them. The cross-validation of this data is still weak, and we need to work on this data. So surgical competence can be enhanced with deliberate practice and simulation, and learning analytics can be beneficial in improving surgical importance. So look at this paper which was published in October 2023, Machine Learning for Technical Skill Assessment in Surgery, a systematic review. And it really tells you that today, deep learning and other can be used for surgical performance, and that is the trend today, what we are really looking at it. If you look at ERIC, there are almost thousands of papers on artificial intelligence assessment which have come, but not many for the medical purposes. But this was one paper got impressed, Artificial Intelligence in Educational Assessment Breakthrough, and it really says means of improving assessment efficiency and validity, computerized adaptive test, and automated essay scoring, and along with the big data analysis. So how might an AI change assessment practices? Let's look at them. What are the new trends going to come? The teachers and students feel strong emotion about assessment. So first is there is going to be less grading and more assessment. So we are going to have now, fortunately, AI does not get tired. And therefore, we can do more and more assessments, continuous assessment, stealth assessment. You're collecting the student's data all the time and trying to tell him what is wrong or right. Students will take a test on computer or a small device, and it will be recorded. Free teachers to engage student-teacher conferences or small groups. It is not that AI replaces teachers in assessment process, it is just outsource the areas more prone to human error. That's all. And the second thing is you will get a faster feedback. Immediately you will get a faster feedback. You will, whatever you are doing, whether I am doing a stitching or whatever I am doing, I'll get a better, analyze, faster feedback based on what is my performance over last month. The third thing, it will give me predictive analysis. Adaptive learning, easy identification at risk students, adaptive assessments, and predictive modeling. Are we falling into a deficit mindset? That was a question we should all ask. More differentiation within assessments. Previously we used to have only two assessments, pass or fail, or distinction. Now you will have a graduated assessments. And this is something they will come to know, and they will also tell you which group of students need better kind of a thing. And empowering students to their own assessment. Now this is one area which we have not dealt as a universities. Now this is something AI will do it. So empowering students is something students can set their goals because they will get their own feedback. Resource recommendations, what do I need to know? They will find themselves. Performance feedback and learning portfolios. They will develop their own portfolios. So the diversity. And this is something which is going to come. Time management, students will have their own personalized time management. Facilitating reflections. This is something students can work with chatbots, and that can facilitate reflections. Find what's missing. You might want to consider adding a piece there, and personalized feedback. And this is what also we are not able to give to our students. So concerns regarding AI. AI assessment tools chosen largely by convenience and cost rather than pedagogic soundness of core values. Today it is an area of developing, but over a period of time this soundness will come. They will soon become popular and we will see lot of market initiatives. Next conference, I can see AI-based stall which will be there. I'm sure. And I'm sure they will sell to your colleges. The question is how authentic they are going to be there. May outsource most of the assessment processes to a machine in a way that might conflict the teacher's core beliefs. So integration of chat GPT and assessment. This is something which is you must read. This was again published in October 17, 2023. Very interesting article. Personalized, efficient, accessible learning experiences, significant challenges and ethical concerns. Striking the right balance is crucial to realize the potential of these technologies and unbiased transfer assessment process. So, assessment is a conversation, ideally. It's not all the time an examination. An integral dialogue in isolation or conversation with trusted teachers, students and peers. These conversations might be about the word choice or style or argumentation, but they might also be about hopes and dreams and grief and loss. So, feedback is not mechanical, it is relational, it is dynamic, it's contextual, it's even at times empathetic. I still think there is some potential promise in AI as a feedback tool, but I don't think it will ever replace the relationship aspects of assessment. I think this is something which all we should really remember. So, there has to be a human element in assessment. We empower teachers to use AI tools wisely, we will end up with more human-driven approach. I think it's critical that we retain the human element. We want teachers who understand AI and use it wisely. See, somewhere in 2008, in airline industry, AI came. And everybody said that AI will change the airline industry. Today, nobody really, if you go and in a pilot, I don't know how many of you sat in a cockpit, most of the time it's all AI based. And you can have an pilot-less aeroplanes. You can have the driverless cars. But how many of you are ready to sit in an aeroplane without a pilot? You are not. That means we need now aeroplanes with a pilot who understands AI. Same thing is true. We need now surgeons who understand AI. We need teachers who understand AI. So AI is going to be useful to you rather than replace you. So it's a human, and human trained in AI is going to change future and not AI alone. So my hope is that AI will not replace teachers. Instead, my hope is that it will free teachers to give the kind of feedback an only human can. And this was a wonderful statement by John Spencer. So thank you so much, and I'm sure we will take any questions if you have. Sure. Mahalakshmi has a question to begin with. Yes, madam.
Dr. Mahalakshmi, I was looking at you.
Our knowledge partner Academy has already developed a chatbot in physiology. So that helps the students synthesize the concepts. It comes up with personal learning milestones, and it can help you to check.
I did not talk about this, but there was a very nice paper in Surgery 2021 which analyzed the steps of laparoscopic cholecystectomy and 55 ways people do laparoscopic cholecystectomies, and the Mayo Clinic has created a medicine Alexa. I'm sure you will have a surgical Alexa in an operation theater, and if I have a difficulty, I have to ask Alexa, what should I do? And it will tell you, put a fifth port, you stop bleeding here, this is something. Don't worry, it will come. But the question is, the human element is still important in all this.
It is
Sir, what our Tejinder Singh sir said, that last slide, that competence, at that particular moment, Arjuna he was never told to.
Sure. AI will not assess competence, but it will make you reach to the competence by a better
guru
feedback.
Is needed, sir.
Yes,
that
exactly.
Guru is
exactly,
needed.
exactly. I think so.
Sir, thanks for a nice presentation. Today only one session for AI. I think you also told that there are a number of stalls will be there in the next conference. But I think the theme for the next conference may be AI in medical education.
I think so.
It is involving in all the
No,
fields of medical education.
I never, I have been in AI for many years, but you know how many papers are published about AI in medicine? 183,000 in last, say, and most of them are in last 5 years. Even a field like surgery, you have papers, about 5,000 papers in AI in surgery. I think it's all now time to look at these papers. I'm not saying you have to adopt everything, but the literature is coming, the experience is coming from major centers. I think we just need to look at it and find out where we are going. Are we anything we can adopt? You should not be behind the world in understanding
Sir,
all
we are
this.
very proud sir, that I came to know that you were more than 100 publications with 1 lakh citations. Thank you very much
Sure.
for a nice presentation,
Sure.
sir. Any questions, please?
Sir, thank you first of all for a wonderful presentation. I'm from Malaysia, sir.
Sure.
I'm from AIMS University. I'm an ophthalmologist, but we always fear that knowledge-based subjects, like, you know, the assessment can be made by the AI itself. Will there be cutting off? Because in my university itself, I'm sorry to say, but some of the preclinical and they were all sent home during the COVID. So what will be that particular surgical? I understand, sir, you absolutely said we need the human empathy. And what about those subjects when we have to test them only knowledge based? How is it, sir?
Maybe I think knows some extent knows how, like say, because what are the strengths of AI? AI strength is essay analysis. They will give you themes. You know, many of these they are doing. Currently, what are the themes coming out is essay analysis, POC analysis, all these are their themes. What we have to understand is what are the limitations of AI. And we as a human element need to strengthen that kind of a limitations. So knowledge will definitely be taken over by assessment by AI. The question is how we try to concentrate on then the behavioral aspect, professional aspect, and some part of the competence aspect, how we as a human element can really concentrate. And I think rightly said in the beginning, you know, we try to test knowledge because it's easy, and we don't try to test professionalism because it's difficult. Now, if the knowledge and all this is taken part by the AI, maybe we'll have more time to do skills and competence and the professionalism. So we may shift and try to get better and better in aspects. I mean, ultimately it's a future. I don't know what will happen after 20 years, but I should be aware of things what may be coming in the future.
Sir. Hope so for the better. Thank you, sir.
Sure.
More than anything, what I think, sir, that developing critical thinking and analytical thinking, that is more important, which AI cannot do. So that is the basic
It can
thing.
give you ideas.
Yeah.
I'm not saying it will not give. Yes, it gives ideas. Yes, Dinkar, you want to add anything?
So I think as human beings, we always tend to overemphasize our importance in the big context, larger context of things. And I think AI is probably bringing home to us that maybe we are not as important as we think we are, even though we are the ones who have created AI. And the rate at which AI is exploding in terms of knowledge and everything else, it's not only that they can, to assess the knows or knows how, but they can even assess the shows how shows. And we were talking about pilotless planes and driverless cars. It is a fact that now in the US, in San Francisco, for example, we have driverless taxis. That taxi is summoned by your app, you get in, there's no driver, and it will take you where you want to go.
Yeah, there are there. I mean,
Tesla, I was recently in the US, and my friend has a Tesla, and he demonstrated the beauty of how the Tesla takes the road. I said this will not work in India, because in India we don't have lanes, nobody sticks to lanes. The cameras of the Tesla will not judge those lanes. He said no, Tesla is in fact coming to India, they have tested it in Indian conditions, and it works very well. So the way in which AI actually is taking over everything, I think the sky is the limit. Thank you.
no, this is a disruptive kind of an thought process. See, when calculators came, everybody was worried.
The last
they never
question.
allowed calculator. Then
Due to
Google
time
came,
constraint.
everybody was worried. Your students are finding Google knowledge. I think same thing. Let's look at this as an AI as a tool. Use it more creatively and more understanding. I think don't consider that this is something which is, and after some time I'm sure everybody will have chatbot and AI, you will sometimes allow this. I think it's the way of looking at it and using it properly. Don't have to be scared about it.
Thank you, sir. Just last comment. Before lunch, I am also hungry. So, Supe, sir, as I understand, you said people dealing with images, ophthalmologists, radiologists, they're in trouble. Surgeons are in trouble. Physicians who think are okay.
Yes, sir. Sir told it will not affect our duty. At the same time, so the question, please post your questions by copying the QR code,
Sure. Thank you so much.
and
I
sir
think
will ask your questions during the
Sir,
lunch
anybody
time.
has
Sir,
one more
please stay
question?
back for us to honor you. Sir.
Sure.
Thank you very much, sir.
Sure.
Thank you, sir, for enlightening us
Sure.
on
Sir,
how
thank you,
AI
sir.
can strengthen the practice of assessment, empowering us, the teachers and the students. I request the chairpersons of this scientific session, Professor Pushpa Kotur and Professor B.R. Ashokan, to present the memento to our resource person, Dr. Avinash Supe. I request Dr. Jyoti M. Nagamoti, Professor of Microbiology, JN Medical College, KLE Academy of Higher Education and Research, Belagavi, to present the memento to our chairpersons.
I don't know.
We thank the chairpersons of this session. Thank you, ma'am, and thank you, sir.